So hello friends, welcome to my new video. So this video is the comparison between optic neuritis and papilloedema. So in my previous video, I separately upload video on optic neuritis and papilloedema. But this video here, we will compare these two conditions at a single time. Okay, so simply papilloedema is the swelling of the optic disc and optic neuritis is the inflammation of the optic disc. So this is not same, right? It's quite different because it is the swelling of the optic disc, it is the inflammation of the optic disc. So the etiology is different, right? So let's move to history. So if the person actually having papilloedema, then he will give you the history like visual field loss, transient vision loss, headache, nausea, vomiting tendency, or he will give you the history of taking medications like steroid, retinoids, tetracycline, or oral contraceptive, etc. But if the person have optic neuritis, he will give you the complaints like sudden vision loss, and whenever he move his eye in different gazes, then he feel pain. Okay, so depending on the complaint, you can get an idea that what can be the possible diagnosis. Okay, so let's move to the next slide. Here, involvement of the eye. So papilloedema, it is usually bilateral, but optic neuritis, it is usually unilateral condition. Okay, so causes. So papilloedema, the cause that I already discussed in my last video, that papilloedema is due to raised intracranial pressure, where I told you one factor on my papilloedema video, that Morno-Kelly doctrine, that is the pressure volume relationship between CSF, blood and intracranial tissue and cerebral perfusion pressure. So there is fixed amount of CSF, blood, intracranial tissue and cerebral perfusion pressure is there. So rise in any of that component will lead to rise of intracranial pressure. So suppose there is rise of amount of intracranial tissue, because of the mass lesion growth like tumor will lead to rise intracranial pressure, and this rise intracranial pressure will lead to disturbed pressure gradient between IOP and retrolaminar pressure. So because of the more tissue pressure on the retrolaminar area, nerve ending are getting more tissue pressure, and because of that it lead to damage to the exoplasmic flow. So it is actually the main cause for papilloedema. But if I talk you about the optic neuritis causes, so the main cause of optic neuritis is idiopathic or type 4 hypersensitivity reaction. So optic neuritis can also be due to demyelinating lesions like multiple sclerosis, neuromyelitis optica, or myelin oligodendrocyte glycoprotein disorder. Okay, so here the multiple sclerosis means the demyelination of the optic nerve and nerves of brain, right? And in case of neuromyelitis optica, here it is the inflammatory demyelinating disease involving the optic nerve and spinal cord. And myelin oligodendrocyte glycoprotein, here optic disc, spinal cord and brain neurons at a time get inflamed. So that is myelin oligodendrocyte glycoprotein disorder. So this is the cause for optic neuritis. Now vision status. So in case of papilloedema, retinal nerve fiber layers are getting affected. So that's why the patient will complain you the visual field loss, that is peripheral vision loss. That person will actually give you the complaint. But the papillomacular bundles are getting spared. So that's why he will not have central vision defect until it is the very late stage. But in case of optic neuritis, he will give the complaint of scotoma, central scotoma or peripheral scotoma. But the patient will give you like, he complains like, I am seeing a very fixed black spot in front of my eye, something. So because depending on the complaint or visual acuity or vision status, you can get an idea what can be the possible diagnosis. Now here I was discussing this thing previously, a prelaminar lamina cribrosa, and this is the retrolaminar area. So there is more tissue pressure in this retrolaminar area. Because of the rise intracranial pressure, it will lead to inhibition of the exoplasmic flow, and it is leading to swelling of the optic disc. Okay, now pain status. So papilloedema patient will not give you any history of pain when they move their eye, but they will give you the pain, there is headache, nausea, vomiting tendency. But optic neuritis can give you the complaint of pain, because I discussed there is 3 types of optic neuritis: neuroretinitis, papillitis and retrobulbar neuritis. So this retrobulbar neuritis actually happen behind the behind this zone, that is retrolaminar zone. So this because optic nerve beyond the retrolaminar region getting inflamed, so that inflammation of the optic nerve radiating to annulus of Zinn that is surrounding the optic nerve, and because of the inflammation of the annulus of Zinn also, whenever the person move his eyes in different gazes, he feel pain because all rectus muscle get originate from annulus of Zinn. So that's why optic neuritis patient can give you the complaint of pain whenever he move his eye in different gazes. Okay. Now, presence of RAPD. So in case of papilloedema patient, you will not see presence of RAPD, and you will see both eye appearing in a sluggish manner. But in case of optic neuritis patient, you will definitely find RAPD in that case. Okay. Now let's come to the optic disc. So in case of optic disc, so here this is the normal optic disc and this is the enlarged optic disc, and because of the enlargement of the optic disc, because of the optic disc swelling, it is leading to damage to the nerve fiber layer, leading to peripheral field defect. So that's why this is the optic disc condition. There is large optic disc in HVF, but optic neuritis patient will have disc inflammation, optic nerve inflammation. So because of the optic nerve inflammation, the person will complain you what is a scotoma or black spot. Color vision. So papilloedema patients will not give any color deficiency complaint, or they were not having any color deficiency, but optic neuritis patient have color deficiency. Now if you perform what to say MRI or CT scan to optic neuritis patient, then you will see demyelinating condition there. But in case of papilloedema patient, you will see cystic lesions or edematous condition on the brain. So these things are quite differentiating to each other. So that's why don't forget to take the history very properly, because optic neuritis patients have history of fever or previous infections like herpes zoster, measles, tuberculosis, or optic neuritis can also be present in case of vaccinations against tuberculosis, something like that. So that's why take the history properly, and remember this thing that retrobulbar neuritis and papillitis are mainly associated with multiple sclerosis, while neuroadenitis are more often associated with infectious conditions or inflammatory condition. So that's all friends. Thanks for watching. Please don't forget to like my video and subscribe to my channel. I hope this video help you to differentiate these two conditions quite a bit manner. So thank you so much and love you all.